Dehydration. Do you know what happens to your body when it's dehydrated? Let's unravel this mystery together to save lives. Dehydration, a word we often hear, but do we really understand what it means? Simply put, dehydration is when your body loses more water than it takes in. Now, you might think, oh, it's just water. But here's the thing. Water isn't just a thirst quencher, it's a vital cog in the machinery of our bodies. It helps in digesting our food, keeping our body temperature in check, and even carrying nutrients to our cells. So, imagine running a complex machine without enough oil. That's what happens when your body is dehydrated. The gears start grinding, the system overheats, and the machine begins to malfunction. That's exactly how our bodies respond when dehydrated. So dehydration disrupts the body's normal functioning, but what causes it? Let's dive deeper into this in the next scene. You might be surprised to learn that dehydration isn't just caused by not drinking enough water. There's more to the story than that. Our bodies lose water in a variety of ways, such as through excessive sweating, which is especially common during physical activity or in hot weather. A fever can also ramp up your body's water loss. But did you know certain medications can cause dehydration too? Some drugs, particularly diuretics, increase the amount of water your body expels. It's always important to stay aware of the side effects of your medications. And let's not forget about our dietary choices. Consuming alcohol and caffeinated drinks might quench your thirst temporarily, but they can actually leave you more dehydrated. Both alcohol and caffeine are diuretics, which means they encourage your body to release more water. Now that we know what causes dehydration, let's delve into its effects on the body. Dehydration can have a wide range of effects, some of which might surprise you. It can start out subtly, with a few signs that are easy to brush off. You might feel a bit tired, or notice that your mouth and throat are unusually dry. Maybe you're a little more thirsty than usual, but you just chalk it up to a busy day and move on. But as your body continues to lose more water and electrolytes than it takes in, these symptoms can quickly escalate. Your skin might start to feel dry and cool to the touch, and you could begin to experience headaches or dizziness. You might also notice that you're not sweating as much as you normally would, even in hot weather. As dehydration progresses, the effects become even more serious. Your heart may start to beat faster as it works harder to pump blood through your body. You might begin to feel lightheaded or even faint, and in severe cases, you could experience confusion or even delirium. Over time, prolonged dehydration can lead to more than just discomfort. It can cause serious health issues, such as kidney stones or even kidney failure. This is because your kidneys need a certain amount of water to filter waste from your blood effectively. Please note this signs and symptoms of dehydration to help save someone. Mild to moderate dehydration, thirst, dry mouth and swollen tongue, weakness, dizziness, palpitations, feeling that the heart is jumping or pounding, confusion, sluggishness or fainting, inability to sweat, severe dehydration, extreme thirst, very dry mouth and mucous membranes, lack of sweating, little or no urination, and any urine that is produced will be dark yellow or amber, sunken eyes, shriveled and dry skin that lacks elasticity and doesn't bounce back when pinched into a fold, low blood pressure, rapid heartbeat, fever, delirium, or unconsciousness in severe cases. The effects of dehydration can be severe, but fortunately there are ways to prevent it. We invite you to subscribe to our YouTube channel for enriching content dedicated to enhancing your spiritual and physical wellness. Thank you for your support. Preventing dehydration is simpler than you might think. It starts with understanding the importance of drinking enough water. This is especially crucial during warmer weather or when engaging in physical activity, as our bodies tend to lose fluids more rapidly. Now, you might be thinking, I don't really fancy chugging down glass after glass of water. No worries. Nature has provided us with an array of delicious alternatives. Fruits and vegetables such as watermelon, cucumbers, and strawberries have high water content and can contribute to your hydration levels. But it's not just about what you should consume, it's also about what you should avoid. Alcohol, for example, can lead to dehydration. It acts as a diuretic, which means it encourages your body to lose more fluid than it takes in. So, if you're planning on enjoying a few drinks, remember to balance it out with plenty of water. Caffeinated drinks can also have a similar effect. While that morning cup of coffee might wake you up, it could also be dehydrating you. So, consider switching it up with herbal teas or simply water infused with a slice of lemon for a refreshing twist. Remember, staying hydrated is about balance. Keep a close eye on your body's needs and respond accordingly. But what if you're already dehydrated? If you're dehydrated, don't panic. There are ways to treat it. When it comes to dehydration, the key is to replenish lost fluids and electrolytes. To treat mild to moderate dehydration, the solution is simple: drink more fluids. But it's not always about gulping down a gallon of water. It's about rehydrating slowly and steadily. This gives your body time to absorb the fluids and restore balance. Now, water is often the go-to, but it's not the only option. Sports drinks, for example, can be effective because they contain electrolytes. Electrolytes are minerals that help maintain your body's ionic balance. They are essential for various bodily functions such as nerve and muscle function and maintaining acid-base balance. But there's an even more efficient way to rehydrate: oral rehydration solutions. These are specially formulated beverages that contain the optimal balance of salts and sugars to promote absorption of fluids. They are particularly effective in treating dehydration caused by diarrhea or vomiting. Also, fruits and vegetables high in water content, such as cucumbers and watermelons, can contribute to rehydration. They are a tasty way to top up your fluid intake, and they come with a bonus of essential vitamins and minerals. However, for severe cases of dehydration, at-home remedies may not be enough. Symptoms such as extreme thirst, lack of urination, shriveled skin, dizziness, and confusion are signs of severe dehydration. If you or someone else is experiencing these, it's time to seek medical attention. Healthcare professionals may administer intravenous fluids and electrolytes to rapidly rehydrate the body. Just remember, while it's crucial to treat dehydration, prevention is always better. Aim for at least 8 glasses of fluids a day, more if you're active or it's a hot day. And don't wait until you're thirsty to drink. Thirst is a sign that your body is already heading towards dehydration. Remember, staying hydrated is key to maintaining a healthy body. So keep a water bottle handy and take care of yourself. In addition, what happens to the body when dehydrated? Cellular function. Water is essential for cellular processes. Dehydration impairs these functions, leading to decreased energy production and waste removal. Temperature regulation. The body's ability to regulate temperature through sweating is compromised, increasing the risk of heat-related illnesses. Joint and muscle health. Dehydration can cause muscle cramps and joint pain as it affects the lubrication of joints and the elasticity of muscles. Digestive system. Dehydration can lead to constipation and other digestive issues as the digestive system relies on water to function properly. Cognitive function. Lack of hydration can impair concentration, memory, and mood. Seizures. Electrolyte imbalances can lead to involuntary muscle contractions and sometimes to loss of consciousness. Hypovolemic shock. This is one of the most serious and potentially life-threatening complications of dehydration, where low blood volume causes a drop in blood pressure and oxygen levels. Heat injuries, ranging from mild heat cramps to heat exhaustion or even heat stroke, which is a life-threatening condition. We invite you to subscribe to our YouTube channel for enriching content dedicated to enhancing your spiritual and physical wellness. Thank you for your support. Stay safe and hydrated.